After years of denial, Michael Rodriguez has finally found ways to deal with the symptoms of his post-traumatic stress disorder. He's a retired Special Forces Green Beret. He forges steel to help him manage the often gruesome memories that flood his thoughts.
It's so physical. It requires a lot of force and heat and intensity. I'm facing and processing, a lot of the stuff that I remember. The pain goes away. I'm forging myself.
For 4 years, Michael misled doctors about his PTSD, fearing he would lose his job. There is no concrete diagnostic test that would have forced him to get treatment. In 21 years of service in the Army, Michael was deployed 9 times, from Operation Restore Hope in Somalia to Operation Enduring Freedom in Afghanistan. During that lifetime of service, he was rattled by frequent small explosions, and Michael guesses at least a dozen very severe blasts.
They were significant enough to where I had my bell rung. I could feel it through my whole body. Felt numb, some memory issues, dizziness definitely, vomiting. Anger issues, I was drinking a lot. I was trying to hide it. I was very moody.
Yeah, we're really living in the dark ages of post-traumatic stress diagnosis.
Dr. Sam McLean is a doctor of emergency medicine and anesthesiology at the University of North Carolina at Chapel Hill.
We hope to advance the diagnosis of post-traumatic stress by assessing what's going on in the brain, not simply a symptom checklist, getting at the actual biology that's underlying those symptoms.
Researchers at the University of North Carolina are decoding blood samples taken from recent trauma victims at civilian emergency rooms. They're sequencing the genetic material, RNA, DNA, and other types of molecules to identify biological markers for PTSD.
The blood is such a valuable tool to use to better understand what's going on with post-traumatic stress, because after a traumatic event, the brain communicates with the body via the blood.
Close your eyes.
Dr. Tanya Jovanovic at Emory University in Atlanta is experimenting with the startle test based on evidence that people with PTSD are easily startled even when there is no threat. This volunteer is shown 2 symbols. A triangle means no threat, but a square means a threat is coming. So then when they see the blue square on the screen, they know I'm about to get hit with a strong force of air.
Exactly.
When they see the triangle, they know nothing's going to happen.
Right. What we see in someone who has PTSD is really big links to both the danger and the safety signal. The physiological part of their brain can't tell the difference between danger and safety.
To find out how PTSD physically changes the brain, researchers at the Veterans Affairs Health Facility, just outside of Boston, are using MRIs to look at brain structure and volume, as well as connectivity, to see how different areas of the brain talk to each other.
The goal is get to the point where there is a certain accurate molecular diagnosis that we can make. I'm hopeful that that's going to happen within our lifetimes.
Eventually, Michael's commanders forced him to get help.
And they're like, and you have severe post-traumatic stress. I got upset.
Why did PTS upset you?
Bought into the stigma. But if there was a tangible test, I think it would make it easier on the patients. But because it'll validate it, like if someone has leukemia, no one ever says, you don't have leukemia. Right. So if there is some type of biomarker or something like that, yeah, I think it would definitely help.
I'm Soledad O'Brien in Fayetteville, North Carolina.
Finding a therapist you actually connect with can feel like a lot to ask, but 82% of BetterHelp members We are getting a look at the Chino Hills torture suspect tonight.